All right, we're live, Dr. B. How do you feel to be on video right now?
Great, fantastic. Hello to all of our followers there on Instagram and maybe Facebook or wherever everybody's watching from. We're here at Bauman Medical Hair Transplant and Hair Loss Treatment Center, and we're getting ready for PRP treatment.
Big day for the program.
How are you feeling, Aron?
Feeling good, feeling numbed, ready to roll.
Great.
And also, we have a beautiful backdrop here of the coral reef. I don't know if everyone can see that, but really creating a soothing experience.
How was the local anesthetic process?
I'm not going to look at the video right now. I'm going to look at the fish.
Great.
But the local anesthesia seems to be working well because I can't feel anything that you're doing back there.
Awesome.
So I'd rate it probably a 10 out of 10.
Fantastic. All right.
Oh, we got some people joining. Nice.
Yeah, a lot of people are afraid of having PRP because they think it's going to be a painful process.
I would classify it as not painful at all.
Awesome. Fantastic.
But what's nice is that your staff, before you came in, they checked in and made sure that I was adequately numb.
You were super comfortable.
Super comfortable.
Great. Did you get a chance to use the Pronox nitrous oxide delivery system that we had?
Did.
How'd that go?
It was good. I don't know if everyone knows what that is. Do you want to tell everyone what that's all about?
Yeah, for sure. So one of the things that makes the injections of local anesthetic very comfortable, aside from technique and what you choose to inject, is also Pronox, which is a patient-controlled analgesia system, which means it's for pain control. You just take a nice deep breath of that, nitrous oxide, and everything is all fun and games after that. It feels.
And this is it right here, live.
Yeah, just take a deep breath. It'll change your. It'll change the tone of your voice a little bit lower for about a minute or so. So we're about a third of the way through our PRP already.
Surprising how quickly it goes and how long the impact is.
Yeah, so what we're injecting is platelet-rich plasma. We've got over 1 million platelets per microliter, which is a nice dose. We want to get between 1 million and 1.5 million platelets per microliter. And we're also injecting a biological scaffold at the same time, which is a placental tissue which has been morcellized for injection, and that's combined with the PRP. And that's what gives it the longevity and the strength.
Yeah, so this is my second time doing it. I would say that the biggest difference was just how thick and strong and, dare I say, powerful the hairs looked afterwards.
Yeah, I was going to ask, what did you notice, and when did it happen?
Well, I remember I was talking to my friends, and I was like, I'm telling you, these hairs are thicker. And they were like, how is that possible? Because your surgery was the other day. Then when they saw me, they were like, wow, the hairs really are thicker.
Yeah, so
it was crazy.
That's exactly what PRP does. For us, it's a one-time treatment that we would do for you each year. And it's going to make the hairs grow thicker, stronger, longer than they are normally. So that's a good thing.
Definitely.
So when you first came in, we took a sample of your blood. We didn't get that on video, but we did the blood sample. We tested it to see how many platelets were in that sample. And then we prepared it. We separated it using a very special dual spin process, which allows us to get a very high concentration of platelets in the final PRP. And if anybody has any questions, you can obviously DM me or post them into the responses.
We do have a question.
Oh, yeah? Okay.
And the question is it possible to stop hair loss completely with a regular PRP?
Well, first of all, it depends on what kind of hair loss you have. PRP is a great treatment modality. It may not be a miracle cure for every person. That's why you need an evaluation with a board-certified hair restoration physician to determine that. So a complete measurement and a microscopic evaluation, diagnosis is necessary, and a discussion with your doctor to determine what areas might respond to PRP.
And we actually have a second question.
Okay.
And the question is, are there any side effects?
So after the procedure is completed, the scalp is definitely going to be numb. So Aron, you're going to feel not much of anything up here for a couple of hours.
Cool.
The scalp is going to be a little bit pink for a few hours. And so we ask you while that process is completing not to do any kind of heavy-duty hairstyling with any, hot hair dryers or things like that, or do anything that might put your scalp in danger of injury. But the good thing about PRP is that there's absolutely no side effects to the treatment.
That's right.
You're not going to have any kind of visible sign that this procedure has been done just within a few hours.
The other thing for our viewers to know is that, and this is good for me because tomorrow's my birthday and I want to make sure that I'm COVID-free so I can see my mom and my family. I got an instant COVID test here at Bauman Medical, and you guys can guess, I was negative. I am COVID-free. They would have sent me home otherwise. So that was a great added bonus today. Pretty safe environment.
COVID testing comes free with every hair transplant and PRP procedure. No, we are COVID protected facilities. So what that means is that we have all the protections and screening in place to make sure that our staff and our patients are staying safe.
That's right.
That would include the fever screenings and also the COVID testing and temperature screenings when you come in. Now, this is the last part of your PRP process. We're now using a microneedling tool as well as a curated growth factor topical. Actually, this comes out of bioengineered stem cells from California, and it comes in this little container here. And these growth factors are going to be microneedled right into the scalp. And obviously, I'm sure you're feeling comfortable, Aron. You're not going to feel anything but the vibration here.
Yeah, it's crazy. I'm doing a close-up right now, and it's interesting to really see what's going on. Oh, we got another question.
Great. You're doing fantastic camera work, by the way.
Thank you very much. Could be a career in future life, or maybe even this life. Does DHT, I'm not sure what that is, or inflammation affect the androgenic areas that you treat? I'm going to let you take that one, Dr. Bauman, since you're the doctor.
Absolutely. So DHT, dihydrotestosterone, is actually the trigger for male pattern hair loss. And so we're not addressing the DHT issue with PRP. That's why we have you on finasteride to lower DHT levels, right? And then what was the other part of the question?
Does DHT or inflammation affect the androgenic areas?
Yeah, so inflammation is really, really bad for hair growth. If your scalp is inflamed, you're going to have an interruption in hair fiber production. So if you have itchy, flaky, oily, dry, some kind of irritation on the scalp, that can definitely diminish your hair quality. So we do have a whole department that takes care of that, actually. It's called Salon B.
What's Salon B?
Salon
I feel like
B,
I've heard of it.
Salon B is my department in the office that is staffed by a full-time trichologist who's trained in Europe, trained in Italy actually, and Kimberly does a full examination of the scalp using a variety of different tools to address inflammation, itching, dryness, and flaking, you name it. So your PRP is just about done. We just finished every bit of the process, all live on camera there.
All live on camera. And I wasn't spying on your text messages, Doc, but I believe your wife asked if you had a specific go-to entree for a restaurant that she has in mind. So just want to call that to your attention. So once we get off of this live, you can respond to Karen.
Hi, Karen. I wonder if she's watching on Instagram.
Well, that would explain why you haven't responded.
Exactly. Well, there we go. All completed and done.
All right.
So for more information on PRP, you can DM me if you have any questions, or if you'd like to have a consultation for your hair loss problem, check out baumanmedical.com, BAUMAN medical.com, and I look forward to helping you.
And I will just say this. I came across somebody in Dr. Bauman's office today, and she asked me, or she said, "You didn't get a hair transplant surgery, did you?" And I was like, "I did." And she was like, "That's crazy because I can't even notice." And she works here. And for me, that was like the craziest thing because it just shows how natural it all looks. So we wish everyone a great day. Oh, wait, no, we got another question from somebody. How long does it take to heal and see growth? I think it's pretty quick, but I'll let Dr. Bauman.
Yeah, great question. So there's really no healing at all. There's nothing for the scalp to heal. You're just going to see a little bit of pinkness, a little bit of redness for a few hours. But the growth does take months to come on. So it does take about 3 months to start to measure improvements, and then they start to plateau about 6 months to 9 months out with the way that we did the process today. And so the results will typically last for about a year. But yeah, it does take about 6 to 9 months to really see the results in the mirror or on a photo. But we can measure them a little bit more quickly.
All right. That's my phone. All right. Well, with that, we wish everyone a great day.
You can go ahead and click in.
There we go.
Save it.